Total cases, an increase of 700. We now have a total cumulative cases of 43,122. Number of hospitalizations, 16% of that, and that was an increase of 53. If you look again at the numbers, fairly big jump in the number of cases in the last 24 hours. If you look at the deaths, that is under the 21-day average. If you look at the number of hospitalizations, that also is under the 21-day average, and ICU admissions is also under. So if we look at the total number of cases, we will see that is a jump, and it's due for probably a number of reasons which we'll talk about. What we have been seeing, however, is statewide a downward trend, and today might just be an exception, but we're seeing a downward trend. But the exception of that is Southwest Ohio, and I talked about Southwest Ohio last week a little bit. Yesterday we talked about Clark County, of course, also in Southwest Ohio, and I want to talk about the counties of Montgomery, Greene, Clark, Warren, and Hamilton counties. And I'm going to go through each one of these counties' data. But we have a group that works, does this every day in the health department, who go through all the numbers. And what they supply me and what they supply the director and the local departments is information if they're starting to see trend lines that are worrisome. So the trend lines that we're seeing in these 5 counties are worrisome. Let's just put it that way. Let me start with Montgomery County, and you can see cases going upwards. These numbers we always show as incomplete. So these numbers we would expect to go up. They will go up. We just don't know how much they will go up as the data comes in for those particular days. So you can see a rather dramatic increase from May 25th through June 13th in Montgomery County. You can see on this example that cases have been on the rise for the past several weeks. Some of the latter days are marked incomplete, as I said, because the data is calculated by onset date. This means we don't know this information until a sick person may go to the doctor, which may be several days after the person starts feeling ill. Let me move to the second chart in regard to Montgomery County. This shows simply mobility. People are moving around more, and this is not unique to Montgomery County. You would see this to some degree if you did any county in the state of Ohio. When we first started looking at these numbers, looks like it was in January, around February 1, I guess. And what you've seen is that the driving went down. Statewide, it went down close to 50%. Here we're showing it looks like about 45% it went down. Then it's gone back up. Driving mobility in Montgomery County has now surpassed pre-COVID-19 levels. So it is back up. Part of that difference is time of year. I suspect that there's more driving in the summer. So again, it just shows you kind of the trend lines that people are, very understandably, it's nice weather, and people are moving around a lot more. Eric, let's look at the next number for Montgomery County. This is by zip code. And these are the zip codes. The red would be the ones that are showing the most cases. These are the zip codes 45424, 45417, 45426. And so you'll see Huber Heights, you'll see Riverside, you'll see parts of Dayton, and you will see Trotwood. We're also there seeing some workplace outbreaks in addition to the community spread. Crocs, for example, distribution center, nursing homes, and a few other places that we're seeing this. Let me turn now to Greene County. Again, Greene County, not nearly as many numbers, but the trend line is the same. Trend line is going up rather dramatically, as you can see here. Two zip codes, basically Fairborn and Xenia. We'll go to the next line. So basically Xenia, where we're seeing numbers, but the real bigger area is Fairborn. Now it's all over. We have community spread virtually everywhere, but these are the two zip codes that we would particularly worry about in Greene County. Let me move now to Clark County. Look at the Clark County numbers. Again, we're starting to see spikes here. Again, this is incomplete data, so you already see the trend here. And we'll see what happens when these numbers are complete, but you're certainly seeing a trend line there. In Clark County, there's a hot spot, the Dole plant, which we discussed yesterday. Most of those, 95% of those Dole employees actually live in Clark County. There's also an outbreak at a nursing home that had 37 total cases. Let me turn now to Warren County. Look at the numbers from Warren County. Again, you see a jump there. Again, these numbers are not complete. And the team that's looking at this is looking at a lot more data than I'm showing, but I'm just trying to illustrate what we have here. Let's look at the zip codes for Warren. Again, Warren County, you can see, and this is, the numbers are about how many, this is based on residents, basically where people live. So what we are doing is we're sharing this with the counties, and many times they have their own data. They have the same data that we're looking at, so they already know that. We make sure they are seeing that. Let's go to Hamilton County. You see, again, movement up in Hamilton County. Concern about that. Let's look at the zip codes there. And again, you can kind of get a feel for the hot spots. Let me talk now about what our plans are. None of this should come as a real shock. We're going to see hot spots. We're going to see increases in cases at different times in probably different parts of the state. And we don't know. But seeing it move up in southwest Ohio is something we clearly need to respond to. So the action that we're taking, that we have started to take today in regard to southwest Ohio, and particularly with those 5 counties, will be what we will do when this occurs in other counties. So we did a conference call this morning. We brought together a number of the mayors. We brought together county officials. We brought together health officials with our team and just really kind of talk through what the plan is. So what we are going to be doing, you're going to see us move in more heavily with the National Guard that will be doing testing in different sites. We're going to work very, very closely with the hospitals in the region. Work with them as far as the testing, but also we're going to be doing testing in locations that we will be announcing, that the local news media will be given information about. So we would encourage, when you look at these locations, and you'll see this if you live in the Dayton area or if you live in the Cincinnati area, you're going to start seeing in the next several days more information about more places where you can get tests. Again, I want to emphasize we're at a new phase now. We're at a phase where, to be aggressive, we have to test more. We now have the capability of testing more. That capacity continues to go up, and so we now can test anybody who wants a test. We would be, particularly if you live in one of these zip codes, we would ask you to get a test. So what we're going to try to do with all the different zip codes that we showed up there that are hot spots, where we're seeing an uptick, significant uptick, number of cases, we're going to try to put a place there, kind of a pop-up testing for a day or half a day, right in that zip code, right in that area, so people will be able to get to it close to where they live. So we will be having those announcements as we move forward. We already had a number of testing sites already focused on, and in fact, one of the ones we want to talk about, let me just go back and look here. I have, as I said, talked with General Harris and the National Guard. Testing is being done today. Just this morning, the Ohio National Guard and Kroger teamed up to provide pop-up testing to anyone at the Department of Public Safety, which is where we are right now, on West Broad. They'll be back again tomorrow from 8 a.m. to 1 p.m. Again, that pop-up testing location is at 1970 West Broad Street at the Department of Public Safety. It will be open Friday from 8 a.m. to 1 p.m. We also have pop-up testing tomorrow in Elyria from 9 a.m. to 3 p.m. at Elyria City Hall, and it's open to anyone who wants a test. You can just show up at that site during that 9 to 3 p.m. time. Again, Elyria City Hall in Elyria tomorrow, 9 to 3. No cost. People can get tested. Here's a slide that shows a list of pop-up sites for next week, including Portsmouth at the Compass Community Health Center, in Xenia at the Greene County Health Center, in Dayton at the Samaritan Health Center. For more pop-up testing center locations near you, as well as community health center information and retail testing, please visit our website at coronavirus.ohio.gov, coronavirus.ohio.gov. Click on Testing and Community Health Centers at the top of the page. Now, again, in addition to these locations, in the next several days, we will be announcing, this will be available through the news media in the Dayton area and in the Cincinnati area, additional testing locations. And our goal within the next 10 days is to have testing sites open for half a day or day or maybe longer in each one of the zip codes that we identified as being hot areas that we are particularly concerned about. But anybody, whether you live in that zip code or not, you can go and be tested there. Let me move to announcement about hospital readiness, PPE stockpile. As we continue reopening Ohio, it's important that we also continue to build up PPE supplies, specifically for our more vulnerable Ohioans. Today, I'd like to announce a new hospital PPE readiness stockpile. This stockpile will be compiled and stored by Ohio hospitals throughout the state and will be distributed to residents and staff at long-term care facilities should they see a spike in COVID-19 cases. We want to make sure everybody has enough of the PPE. Stockpile is a collaborative effort between the Ohio Hospital Association, hospitals throughout the state, several state agencies, including the Ohio Department of Health, Ohio Department of Medicaid, and Public Safety. In addition to hospitals' own PPE inventory, they have also started to build a 30-day reserve of PPE based off of several calculations, including the state's surge models, number of residents and staff at Ohio nursing homes, as well as recent FEMA PPE allocations to each Ohio nursing home. Each hospital will have a different amount of stockpile that's calculated specifically for that hospital and for that region. The stockpile will be tracked daily by the Ohio Hospital Association's resource tracker, confirming that each hospital has met its target amount and can be distributed when necessary. Having a stockpile like this is really important. And this type of coordination just simply did not exist 2 months ago. And so we're building a lot of this coordination as we go. I want to thank the hospitals for sharing their data, thank the hospitals for sharing the information, working very closely with us.